Older persons, regardless of their background, all want to live their lives safely, healthily, and happily, underpinned by their basic human rights. Although the science and medicine have helped people live longer, it has not always made their lives better. The recognition of older persons' human right to physical and mental health care and support is essential to allow them to exercise all their rights, a right that is too often ignored by governments. And the root cause is pervasive ageism, expressed as policies and laws that drive the political and economic determinants of health. In turn, these amplify the negative impact of social determinants of health over the life force of older persons. Developing and implementing a worldwide human rights-based, ageism-proof system of care and support is now imperative.
Yes, thank you.
The impact of both the COVID-19 pandemic and ageism on older people has shown that relying on goodwill or soft law, like the Madrid International Plan of Action on Aging, is not sufficient. While the UN Human Rights Council's Resolution 54/6 promises to shed light on how older people's rights are impacted in care and support systems, it is not sufficient to address the profound systemic injustices that older people face. Governments must not delegate the responsibility to protect older persons' human rights to elusive member states or stakeholders. As the adage goes, what you permit, you promote. Countries that permit human rights violations must be held accountable. Special UN conventions for women, children, indigenous persons, and persons with disabilities highlight the need for a specific convention for older persons. This will guarantee their most basic right to health, affirming dignity and independence. It is urgent to lead the world in upholding fundamental human rights, and immediate and decisive steps are needed to support the United Nations Convention on the Rights of Older Persons. Implementing enforcement mechanisms and monitoring bodies at national and international levels empowers us to effectively tackle this discrimination and inequality, deeply valuing the agency of every older person. Denial and procrastination in recognizing this pandemic of ageism is costing us our health, our lives, and money, more so than the COVID-19 pandemic. The situation is urgent and it's critical. Therefore, Canada's 12 million older persons are demanding that the draft recommendation in front of us today, namely A/AC.278/2024/L1, be adopted by member states to fully support the United Nations Convention on the Rights of Older Persons. Thank you.